Everyone, and welcome to today's webinar on emergency preparedness and school-based telehealth. We are happy that you are here with us today and hope that you are doing well. My name is Shamika Davis, and I'm a program manager at the School-Based Health Alliance. The School-Based Health Alliance is a DC-based nonprofit founded in 1995 and serves as the national voice for school-based healthcare. Our focus includes policy, standards, data, and training to support and grow school-based healthcare, particularly school-based health centers. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack equitable access to healthcare services. School-based healthcare is one solution, bringing healthcare to where students typically spend the majority of their time in school. When schools, families, students, and the community work together, students win. I would like to share a few reminders for today's webinar. All attendees are in listen-only mode. To ask a question during the webinar, please use the chat function at the bottom of your Zoom control panel. Closed captioning is enabled. To turn it on, please click the CC button on your Zoom control panel. At the end of today's webinar, we invite you to complete an evaluation. Your responses are important for helping us to understand how to improve our work. And also, I would like to share that in the upcoming days, you will receive a copy of today's presentation slides and recording. I am happy to introduce our presenters for today. We have Amanda North, who is the Executive Director at the Center for Rural Health Innovation, and Kathy Weberly, who is the Director at the Mid-Atlantic Telehealth Resource Center. I now welcome and happy to introduce Amanda and Kathy. Amanda and Kathy.
All right. Well, before I share slides, I'm going to just say a few words about who I am and why I'm here. So I'm Kathy Weberly, Director of the Mid-Atlantic Telehealth Resource Center, and we are one of 12 regional and 2 national resource centers funded by HRSA to provide free technical assistance and training around telehealth. And so this, everything from soup to nuts telehealth has been in our wheelhouse for the last 12 years now. And we went through the whole pandemic emergency and helping providers flip to telehealth in that rapid pivot phase. And so it's been a really exciting process to see the movement toward telehealth when we've been fighting for about 10 years prior to the pandemic, trying to get people to use it. So that's part of what we're sharing here is some lessons learned from the pandemic, as well as lessons learned from the decade plus of doing telehealth. And Amanda?
Thank you. So I'm Amanda Martin North, and I'm the Executive Director for Center for Rural Health Innovation. We are a community-based nonprofit. I'm actually located in North Carolina in the mountains, not too far from Asheville. And I have been running a school-based telehealth program since 2011. So we've just completed our 13th school year of providing school-based healthcare via telehealth into rural public schools in North Carolina. And we have grown now from our local community to serve about 110 public schools in 9 school districts across North Carolina. And I've had the pleasure of working with Kathy and the Mid-Atlantic Telehealth Resource Center as a consultant, sharing what I know. Maybe I've talked to some of y'all before, I don't know, about how to integrate telehealth into your school-based health center or how to make school-based healthcare happen because you have access to telehealth. So Kathy is the expert on all things telehealth, and I'm the one who sits over here in the school section with plenty of experience to share. So we're excited to get into this with y'all.
Awesome. Let me share my screen real quick. All right, so we are talking about emergency preparedness in school-based telehealth. And what we want to do is start with a poll. So the first question is, are you using telehealth as part of your regular school center operations? And go ahead and answer that poll.
Kathy, I didn't realize I wasn't going to get to vote myself. This is so sad.
Oh,
It says that I'm not allowed to. But yes, I can say that my organization uses telehealth every day. And I'm pretty sure that a lot of the schools that we partner with are used as emergency shelters when needed.
and then the second poll question's also on there. So are any of the schools you work with used as emergency shelters for your county, city, or region? So if you guys can answer that, and then we will flip to the answers just to see where things are at. Hey, Gretchen, can you go ahead and flip to the responses?
Yes, we have for the first question, are you using telehealth as part of your regular school operations? 24% responded yes, at least weekly. 47% responded yes, but only on occasion, and 29% no, all care is in person. For the second question, are any of the schools you work with used as an emergency shelters for your county, city, region? 11% yes, 33% no, and 56% not sure.
Hey, interesting. We have a good mix of people who are using telehealth on at least some basis, and a few that are not at all. So we're going to try to tailor what we say for all three populations, hopefully meeting all your needs. And then the emergency shelter thing is really interesting because I think that is going to be something you're going to want to find out in these upcoming weeks, because that may impact how you do some emergency preparedness planning. Right, we have one more poll that we want to do. So what types of school emergencies have you experienced? And these range from, your typical weather, snow event, all the way to school lockdowns because of fights, violence, to protests and riots that are happening outside your school. And then some of you might have other. And if you do click other, can you go ahead and put in the chat what that other is? We'd be very curious in knowing what some of those others are.
So Kathy, just, because I can't have, quiet time while people are trying to decide what boxes to tick. I have to tell you that we were providing telehealth services into a school district down east in North Carolina, down east meaning closer to the coast as opposed to in the mountains where I am. And a hurricane came through and absolutely flooded this county where we serve. And their schools were not only closed to, student attendance, they were all shelters for like 6 weeks. It was a really significant impact on the whole community and the schools.
All right, we see the responses. Gretchen, you want to
Yes.
share those?
Yes. For the poll question, what type of school emergencies have you experienced? 78% weather, 56% for infectious disease, 56% for crime or safety, 28% for environmental hazards, and 17% for protests, riots, or other civil disorders, and no responses for other.
All right, it looks like we captured most of the major categories then of emergencies, so that's great. I am unfortunately or unpleasantly or pleasantly not sure surprised about the number of you who have had the crime or safety issues in your schools. That seems to be a growing trend with school lockdowns, whether it's weapons or fights or bombs. And I think we're probably going to be seeing more and more of that, unfortunately, in our climate right now. And it's something that we didn't used to factor it. Like when I was growing up, it was like we had that bomb scare thing where someone called in a hoax, and we all kind of just like hid under our desks. I mean, it was really stupid kinds of things. But now, like, we have some serious threats that can be very real. And so how do you prepare for that? All right. I'm going to start with just the planning process that FEMA, which is the Federal Emergency Management Agency, suggests in their comprehensive preparedness guide. There are 6 steps to that, and we're going to walk through each of those during our presentation, specifically to how it applies to FQHCs in school-based health centers with telehealth as a component of that. So the 6 steps, just in big picture, are the forming a collaborative planning team, understanding the situation, determining the goals and objectives, developing the plan, preparing and reviewing the plan, and then implementing and maintaining the plan. And I would venture to guess that many of us do not have any kind of plan at all in place. And so that's really like, if you take away nothing from this, like, have a plan in place. That's your first step. So the first part of forming a collaborative planning team is, like, I've listed a bunch of strategic questions to ask yourself. So first of all, how connected are you, your federally qualified health center, school-based health center, to your community or regional emergency preparedness or planning effort? So the questions you ask yourself are, do you know which state entity is responsible for emergency management? So wherever you may live. Do you know how emergency management is organized in your state? Because some states have regional offices, some have local offices, some just have a state office. Does your state have an emergency management program specific to healthcare? So I'm in Virginia, and we actually have a healthcare emergency management team with regional offices in place, which is very different than your general emergency management. So that's one thing that makes it different. Then do you know how to access your state's medical reserve corps? Because that may come in very handy if you do have a huge outbreak or a mass casualty event. And you may be the only person in town if you're in a rural community, and you need to be able to then connect to the other medical providers who have enrolled in the medical reserve corps. Amanda?
So this is where I would say don't ever consider that this is something for you to plan all by yourself. So whether you're coming from a clinic or a community health center or a school-based health center that stands alone in some way, regardless of your role, this is encouraging you to go get involved and be part of it and have your voice heard, and also make sure that the needs of the people you want to take care of are accounted for. But I can't imagine in any way that it makes sense to try to have we're going to do this all by ourselves emergency plan. So this is about how to be involved. Don't try to go it alone. You also don't want to assume, right? And I think we saw this during the pandemic, but it's worth repeating. Just because the kids are all at home, they're fine. We get that kind of, it's easy for people to assume, well, we don't need to worry about school nursing. If the kids are all at home, their parents will take care of anything that comes up. But we know there's things that school nurses do that parents don't do. That sort of mentality. So if you're the one who can speak for the students in your community, then make sure that you are doing that, or if you can speak to their healthcare needs. So that was a little bit of a rah-rah for this step, is don't try to make your own team, but go join a team.
Yeah. And I would also add, like, planners also make assumptions of what FQHCs or what school-based health centers do and don't do. And so if you are not at the table in some of those conversations, some of those assumptions could be really, really wrong. And so it definitely helps to at least be part of that conversation. So the second part of that is understanding the situation. And this is an interesting one, because if an emergency impacting the schools occurs, how will services at your school-based health center be impacted? And you really should think this through. So what gaps in service will exist and who would be impacted? Is it just the students, or is it students and family members, or is it also teachers and staff? Do they also access your school-based health center? What about volunteers? Do you use volunteers to help with your school-based health center, and they're now not able to get in? Community members, do they use your school-based health center? Will they be impacted? And then you really need to think about this. At what point will those gaps begin to pose an unacceptable risk? Right? And there's a huge difference between, let's say, a one-day snow day versus a 3-week quarantine versus a multi-month pandemic. And so if you could just put in your chat, like what services do you think would be most impacted if, let's say, you had an emergency that shut down schools for more than a few days, you know, 3, 4, 5 days. Just go ahead and put that in the chat. Like, what are some services that you think would be would be necessary and you there'd be a gap?
Well, Kathy, they won't let me add to the chat either. I'm so disappointed.
Oh,
I guess I could just talk since I have a mic on. So while other people are, here we go. Some people are writing. Thank you. We'd be happy to see what else you have to say. In the program that I run, which is entirely telehealth based, if the schools are closed, right? If the children are not at school, then our program is very, very hard to operate because we're entirely based on the idea that the students are at school with access to telehealth equipment, to a school nurse who knows how to use it. And so their acute medical needs, their medication refills, those sorts of things can be neglected. And in the case of the program that I run, it would be students and faculty and staff, but not wider community members. We're not serving them. Yeah, and we found out during the COVID-19 pandemic that a couple of days was no big deal, but once we started getting into weeks and months, we had things to overcome. We couldn't let that just be. I'm seeing over in the chat access to emergency contraception. That's certainly timely. Access to behavioral health care also can be very timely. And then another behavioral health and clinic needs. So I guess kind of whatever you would come to the clinic for is maybe included there.
yeah, and those are all like gaps, where if you miss one day, it might be okay, but if you start missing multiple days, I mean, certainly emergency contraception is very timely needed. But for many of the students, behavioral health care is huge. And if they are missing appointments for a week, 2 weeks, 3 weeks at a time, that could seriously impact their ability to function at school, to function at home. And I don't know, if most of your clinics are kind of acute care or primary care or all of the above. But we know that we worked in some schools that really did like diabetes management, that did a lot of the kind of chronic disease management and care. And so for some of those services to be interrupted, a day or two might not have a huge impact, but when we're talking about weeks and months, it's a huge impact. And so, really thinking through what is the risk? What is the risk analysis of different emergency types? So number 3 is determining your goals and objectives. And I think this is the question that I really encourage people to think through seriously, because as you're thinking about your emergency preparedness planning. So what are your operational priorities during an emergency, and how can telehealth be used to facilitate those? And how would you define success? And so what am I asking you to think about? What type of care is your operational priority? So is it purely crisis management? So if we're having an emergency, we just want to deal with, kids or community members who are in crisis at the moment. Or is your priority really not having any disruptions in care at all? So if a kid comes in for, their medications and they come in for their behavioral health appointment, we don't want to have any disruptions in care. So even during an emergency, they're going to get their care as regularly scheduled. Or is it really to have access to care for anyone who needs it? And for some of your school-based health centers, you may be, if you're in a rural area, the only access point to healthcare in a multi-mile radius. And so maybe your operational priority at that point during an emergency, if there's a hurricane or whatever, is we want this access point to be available to anyone in the community who is impacted by this emergency. Also think about, in terms of your target population, what is your priority? Is it just for existing patients? Is it their immediate and extended family members as well, if you don't normally see them? Is it for all school students, faculty, and staff? So, let's say you have a violent situation in the school, a gun shows up, people are a little bit traumatized. Maybe there was a shooting incident in the playground. Um, who are your behavioral services going to be for? Just the students at the school, just the ones that who are your existing patients, or anybody at that school? Or is it open to anyone in the community? And those will all impact how you set up your emergency plan. And so really thinking through that and having that defined is going to be really important before you have an emergency.
Okay, here's where you get to hear more from me. Because it depends on what you're trying to accomplish, right? So if anybody's completely new to telehealth, which it sounds like there's only a few people who haven't done school telehealth, so I'm assuming you've done some kind of telehealth. We know that that is a super broad name that could mean just about anything. It seems like sometimes, okay, it's not that broad, but it could mean a lot of things. So we kind of wanted to start with two different categories. One is the connection, like where are you going end to end to accomplish what? Like, what are you accomplishing using telehealth? Sort of what service are you replacing? And then also to talk about the locations of where the provider and the patient might be at any given time. So those are two kind of scenarios to think through about, can telehealth replace some service line we've just identified as being critical and we can't do without it, right? Because we don't need to replace services that are not critical that we could do without, right? So don't spin your wheels on the things that we would be okay without. But what do we really need to solve for? So I think if you go to the next slide, yes, okay. So this is thinking about service lines that could be replaced, right? And then how you might do it. And this is an emergency situation. This is not best practices for everyday school-based health centers. I don't want to be seeing school nurses calling for an antibiotic on the phone. That's not what we're here talking about. But in an emergency, you know, a basic phone call or a basic video call, similar to what we're doing right here with Zoom or FaceTime, can actually accomplish a lot of things, because you can have that check-in with your therapist. You can check on that child who started some new techniques to help him sleep. And instead of having him come back into the office at school, a phone call to the home and ask him to be put on the phone actually is a viable alternative in this emergency situation. And all of that comes under the heading of telehealth when it's in this setting. You know, it's not just a phone call check on. Also, medication refills that you are already anticipating probably can be accomplished without an office visit if we've set aside the need to bill for that service at the moment. Then we can have, as an alternative, as sort of the next step up, is the enhanced video calls with an exam. And in this case, I'm talking about using telehealth equipment. I mentioned it before about putting telehealth equipment in the schools for the school nurses to access. This might look like a cart. It might be a mobile kit that fits in a backpack or a pouch of some kind. But generally, it's going to include a way to have this two-way audio video live, as well as perform an exam that would include a camera for looking at, you know, eyes, head lice, rashes in awkward places, that sort of thing. And then also an otoscope to see eardrums and a stethoscope for heart and lung sounds. That exam can be done by a patient on themselves. A lot of the equipment is really straightforward. We've seen kiosks in places that can try to accomplish this. But more likely it would make sense for it to be done by a trained layperson or a nurse, like a school nurse or another community worker with some medical background. Mostly to be able to do things like reliably take vitals if they're doing a comprehensive exam. And for that, I mean, or that would rather be the solution for a new complaint or minor injuries. Remember, we're not setting arms over telehealth, but we might be able to give advice about, like, yes, that wrist exam that you helped me perform on you warrants an x-ray, or maybe it warrants ice and wait. Those are reasonable things to help coach patients through over telehealth. And then, of course, diagnosing and treating contagious illnesses without exposing the provider to the illness. Like, gosh, what could that be? I can't even imagine why we would ever need that to keep our providers healthy. So I tried to do some broad strokes there on different kinds of solutions, because you don't need an enhanced video call with an exam camera and an otoscope in order to do a therapy session, right? So make sure that you don't over solution or make it harder than it needs to be. And then again, we're talking about who's on which end of the connection and where are they sitting. So in one scenario that we saw plenty during COVID, especially in my rural area, was providers working remotely. I don't know, I shouldn't say especially in my rural area, but I do know from my personal experience here that it was happening here in the rural areas where providers were working remotely, like usually from their home or some other place they could get good internet, delivering care via telehealth into an existing school-based health center, into other telehealth access points like community centers, senior centers, libraries. Of course, the emergency shelter, that wasn't really practical to COVID, but it could be in different kinds of emergencies. It could be to home, right? And this is a very interesting one. Arguably today, here in North Carolina, school's been out for a month, right? Because it's summer break, not because we had an emergency. But our behavioral health care providers follow up every month with some of their patients. And so today, the same provider had a visit with her usual third Tuesday of the month crowd, but from the home. And they were at home on a parent's device or on the Chromebook that the school let them keep all summer, but that has internet access. So it could be a school-owned device, a personal device. And we're doing that today. We're treating, it's not an emergency. We just know that those children aren't at school, but it doesn't mean we have to stop caring for them. So again, don't make it harder than it needs to be. Providers working remotely might be able to furnish care into the school building, but not necessarily the school-based health center, depending on if it's a physical space in the school. It might be to the school nurse office. It might be to the gymnasium where everybody's bunked down because it is a true shelter in an emergency. And then it gets interesting and we flip it a little bit like I was just talking about. And the providers go to their usual place. The providers come into the clinic and they're sitting in front of their computer just like they ever do. But the patient is not in exam room 1 or exam room 2. The patient is at the shelter, at home, wherever they might be. We learned during the COVID pandemic that a lot of providers did not have adequate internet at their homes to be able to conduct video visits, even if the patient did. And of course, there's lots of variability there on who has what. And even, sad to say, some of the provider offices, like private practices in the community, they have fast enough internet to be able to use an electronic health record, but not to do video visits. So, you know, my personal experience there with our primary care doctor here in town was that he tried to have a video visit. It was all blurry. It never quite came in. It broke up a lot. And finally, he just picked up the phone and called. That was a little disappointing. But he was also doing the best he could. So I'll cut him some slack. But, you know, we can plan ahead and we can know that that's not actually a great alternative. That's not a great solution. So let's see if we can do better than that in the future.
Yeah, and I would also add that, during an emergency, sometimes the internet is not working as well as it should be because everybody is using it to try to communicate, to access health information, to access safety information. And so, what used to be a really good signal, suddenly your whole community is trying to access the same communication channel and everything is lagging and slow. So I think that is something you do need to prepare for and think about. All right, so step 4 is developing the plan. And I think this is the part we're going to spend a little bit more time on because there is a lot in terms of telehealth, as well as in general emergencies that I definitely recommend having a written plan on. So oftentimes people think about their plan and it's in somebody's head and that person leaves and then nobody has a plan. Or it's jotted down in a binder on some notes or on some computer file, but it's never like disseminated to anyone. And so what I'm going to do is just walk through some things that really you should think through and have in your plan. So does your plan have a section on how you will communicate or access information if broadband or cellular services is interrupted in your community? Because this will happen, especially in a weather event. You may not have any broadband. And if you're used to communicating by broadband or doing your telehealth visits, obviously by broadband, or if all your communication is by cell service, what is the alternate? Like, do you have some redundancy in there where you have some other means of communicating. And hopefully it's not like smoke signals, but what is that alternate plan that you might have? Does your plan also include how you will address your own facility being impacted? So let's say you have a school-based health clinic and the clinic itself is underwater. Or if your FQHC, is shut down because it was hit by a tornado. How will you address your own facility being impacted and providers needing to work from alternate locations? And if home is not a viable option, what might be an alternate location that they could go to? Because sometimes providers live right near where their work is, and if power is out for that whole area, or if the tornado hit that whole area, where's that provider going to go to provide some services? So really thinking through that. Do you have defined roles and responsibilities for staff and providers? And this is everything from who is going to communicate with whom. Like we have an emergency, who's going to share like we have an emergency right now and our emergency plan is now operational. Who's actually going to convey that information? How are you going to get access to like patient records? Who's going to let patients know that services are potentially being disrupted? And what are your priorities? So those are really important things. Other questions to ask: what types of school emergencies are high probability ones around which you should have detailed planning? So you don't have to have a detailed plan for everything. If you live in like tornado belt or hurricane corridors, you definitely need to have a detailed plan for that, because every year something, at least something's going to happen. But if you are, in California and you're not likely to have a hurricane or a tornado go through, you might want to have just a general plan for, those types of weather emergencies, but you might not need to have a detailed plan for that. But really think about like what are your most high probability ones and really think through those. How will you access student or patient records if the school building is closed or not accessible, or if and when the internet access is interrupted? And that's going to be really important, because you may need to be able to pull a record to find out, should this student have medication that needs a refill, and they're calling you on the phone saying, I need a refill for this. And if this is not a student that you're super familiar with, how are you going to access that kind of information? You might not be able to. I mean, the
I think,
reality is,
Kathy, I think that's a really important point, is the answer may be no, right? Like we're going to have to get by without having their full records. But we have a comment in the chat. Wildfires are more common now.
mhm,
West Coast folks always need to be prepared for earthquakes.
absolutely.
So I haven't really ever lived anywhere that there are earthquakes. I'm assuming that those are the kind of thing where you could have a few seconds worth of damage that takes months to recover from. Does that sound about right? So you could lose a school building, arguably, or a part of a town. Yep. Thank you for confirming. That's just a little bit out of my personal experience. Yeah, that's a super big deal. And that's the kind of thing that if the electricity was off, if the internet was off, we're not pulling anybody's record out of their electronic health record. But in day 2 and 3 and next Monday, when those children from the school building that was damaged by an earthquake are, I don't know, absorbed into neighboring schools or whatever might happen in those cases, those electronic health records are available. Okay, you may not be allowed into buildings until they're inspected for safety. Sure, that makes a lot of sense. So you might have a perfectly lovely building sitting there that you can't go into.
Mhm. Exactly.
That would be frustrating.
Yeah. But during like major public health emergencies, some states have kind of the emergency access points for internet. And so if you are an emergency provider, you may be able to access some of those emergency access points. And so that may be one way, but you need to know what those are, so that you can access the internet through the emergency use internet. So that's another reason why you really should be connected to your state or regional emergency preparedness plans. Other thing I ask people to think about is like what equipment is needed and how will it be kept up to date and tested. So some people will say, "Oh, I have this emergency like telehealth kit, and it's like sitting in my room, and it's like it's in a bag, right? Like so, I've got my laptop and everything." Well, if you haven't had an emergency in like 9 months and nobody's touched that laptop in 9 months, you don't want to open up your laptop and have the first message you get is like updating hardware and software. Please wait, because you want to be able to access things. So really thinking about in your plan, like who is going to be kind of constantly like booting that laptop, updating the software, making sure that things are working. Those are not things you want to wait until like the moment of an emergency to realize like, we have like 6 different software and hardware updates that need to happen. And it's going to take like 20 minutes to like reboot this system. Another thing to think through, and Amanda can jump in as well, like should software be pre-installed on a student laptop? And sometimes that answer is yes, because that laptop is going to be with that student. And so if you want that student to have access to things, that should be installed. But then you have to add the question, like who's going to do it and how will it be tested and kept up to date?
Right. And this is a terrific question and an interesting thing to think about, right? Because like what is it that we would put on a student laptop, right? Is it the portal to your health center? But does that make sense for that to be on student laptops? And how do we make sure that there's not protected health information flowing and that's not available when it's not emergency time, unless you want it to be? So there's some interesting things on there. Or is it simply because there's a web browser, they have access to a video call? So this is keeping it very simple. This is not going to be an enhanced visit with any software that's on a student device, because that device is literally just a laptop or a Chromebook. But it's not a bad idea, and if you use some other telehealth platform, especially there's a lot of them for behavioral health that have a proprietary platform. So it's not Zoom or FaceTime, it's some other thing that's embedded in their proprietary portal. If your school district or your health center uses something like that, you might actually be able to make the case to go ahead and pre-install that, have automatic updates turned on, and make that arrangement with your school district to do that. Because if you think about I was just sort of thinking about children in like preschool and kindergarten being little cootie vectors, and how they spread out. But the same thing could happen with their Chromebooks, that it becomes an access point, not just for that child, but for everyone in their family to be able to access the services that you are going to provide in a prolonged emergency situation. It's kind of an interesting way to justify using a school resource more broadly in the community.
Yeah. But those are conversations that, like for some school systems, it's going to take approvals from IT. It's going to take all sorts of security checks and clearance, and you need to be prepared for that. So it's not the kind of thing where, like, oh, there's a hurricane that's like in the forecast for Friday. Let's figure this out now. And it's like Wednesday. So, you really want to have these conversations early on. So how will students who don't have internet access your services? So that's another thing in emergency. It could be that they just don't have internet access because they can't afford it, but it could be that their internet access is wiped out. So really thinking through your plan, like, are there some alternate telehealth access points that they could go to that are, within the community? For some places, that emergency shelter is the school, and the school, will have emergency internet access. That's one thing. But for some places, if the school is down, is there someplace else you can go? And there's been some really creative solutions out there for telehealth access point. This is like a big kind of word like that is becoming very popular in terms of like how do we negotiate with, let's say, public libraries? How do we New York State, upstate New York, I think Rochester, University of Rochester has negotiated a contract with a group of banks that are in rural areas. And so they are now telehealth access points for University of Rochester Medical. So, I think there's a lot of creative solutions for this. So really think about like what facilities generally have good internet access in your community, who might have a private space where you can install a laptop and a camera, which is pretty much all you need for most things, and where people can go to have some healthcare services if where their typical places are out.
And also the
Um,
places that are going to be prioritized for internet to be turned back on, right? So
Absolutely.
this is at existing hospitals, schools, but also, I mean, I keep the rural hat on most of the time because I live in a town of 2,000 people. Okay, so we're quite rural here, but we have telehealth access points at a couple of remote areas of the community where there are community centers. But a senior center is a great idea. Going back to that idea of whose internet is higher priority or whose electricity is higher priority that might get turned back on first. Um, I like to joke that I don't have to worry about my personal home internet going out or my home electricity going out because we're on the same circuit as the local DOT where they, you know, the trucks that scoop up the salt and take it out on snowy mornings. So we get to hear the beeps very early in the morning, but on the flip side, our power never goes out. And we'll hear that the rest of town is out, but not ours. so, so what are these other magical places who have quicker response or more redundancy? And can we partner there? But remember, if you go stick that laptop and camera there, put it on your calendar to stop by and see it every month to do the updates.
Yep. Yep. And yeah, Amanda makes a great point because there are, and if you talk to your regional planners, they'll tell you like there are certain power grids where they will bring that up immediately in an emergency because you have assisted living facilities, hospitals, places that absolutely depend on power to keep people alive. And those are great places to then find your telehealth access points because if the power goes out, it'll only be a few hours if possible, and it may not go out at all because they have really like secured that and made sure there are not power lines that are um, above ground and all of those things. So really think about where those power grids are and which ones are most likely to be impacted and or restored quickly. So this is an interesting one that we discovered. Will your school IT security policies allow students or family members access to the school Wi-Fi network from outside the building in the event of an emergency? So many schools have very nice Wi-Fi networks that are locked down. And we discovered during the pandemic that, parking lots actually make pretty good telehealth access points because you can sit in your car and access Wi-Fi. You can be pretty private. But we also discovered that many schools, especially like public um, schools and universities, um, some of them tried to make their networks open and their IT security said absolutely not. We can't let people access our network. Um, and there was a lot of back and forth around that. And so this is not always an easy, oh yeah, it's an emergency, just flip the switch. Because you will have IT folks who say, we will not let anyone who is not supposed to be on this network into this network, because then they can access everything from student grades to records, they can hack the system. Um, so you really should have in your emergency communications plan, that conversation with your school IT. If they need to use the parking lot to do a telehealth visit, can they? What would be the process? Who would determine the emergency and how would that communication happen? Because it may or may not be easy just to flip the switch and make that an open network. What privacy and data security considerations are needed? Again, that's that same conversation. What types of technical support might be needed? So you might have great tech support when a patient's in the school-based health clinic. You know exactly who to call, but now the student's at home and you're at home and your providers are at home and something's not working. How are you going to reach your tech support person? Who's going to provide that tech support? And then I'll really think about, so this goes back to that one question about what are the most common emergencies that you are likely to face. So if it's a hurricane versus an earthquake versus a wildfire, if fires or like chemical spills, because you live in an area where there are chemical plants and there's environmental hazards, what types of specialty care might be needed for different types of emergencies? So you might need access quickly to a respiratory therapist or, to a pulmonologist if you have wildfires and you have kids with severe asthma. and you need to get, they're having a critical emergency and not able to breathe, who are you going to contact? What are the specialties? So really have those things in mind, have those set up. So in the event of emergency, may I contact you? This is just for the emergency preparedness plan. How do I reach you? Those are the types of things that you really want to think through before that emergency happens. And then is your emergency, so how will you make sure people know about the plan? And I think this is the biggest part that people forget about. It's like, oh yeah, we have a plan. We spent like months working on this plan. It's in this binder and it's on the internet, right? Like, but the internet goes down and nobody can access the plan. That's another issue. So I don't usually like wasting paper, but sometimes you need to have a printed copy of your plan, because if the power goes down and the internet goes down, nobody's gonna be able to access your plan. So part of that planning is, how are people on your staff? So how are you gonna, is that part of your onboarding documents and training for new staff when you bring on new people? Is your emergency plan part of annual staff training and retrainings? Because you might have a great plan, but if nobody's like thought about it, talked about it in like months, years, when that emergency happens, nobody's gonna know what to do. All they'll know is like there was a binder somewhere in the office. We don't know what's in it. The other thing is, do you have regular, and that could be monthly, it could be quarterly, it could be biannual, depending on how frequently emergencies are likely to happen in your community. Having exercises to test your plan is always a good idea. So let's have a mock drill. We now have a hurricane. It's taken down the school. Everyone's now, piled into another school gym or in a local civic center. What are we going to do now? And test it. Test the internet connection at those places, test your software and hardware, test your video connection, make sure that people know what to do and people understand their roles and responsibilities. There's nothing like as good as actually running a drill and making sure that you know where things are falling apart.
Absolutely.
Yeah.
This is another thing that, it's a rural community, so there's not a lot going on, right? So when they do emergency drills, we all need to be notified in advance, because it would be terrifying. Like, where are all the sirens going? We'd all be on Facebook trying to find out what's happening. So I happen to know that in my community, there's at least a couple of times a year, there are different scenarios carried out for different emergency preparedness groups to work on. And they also practice cool stuff like wilderness rescue. So I think that's really neat. But it's nice to know in advance so that you don't think it's real when all the helicopters start coming and stuff. So we might not be as cool as helicopters, but it may be that when your local community or whoever you're working, going back to, remember slide 1 that was like, don't do this by yourself. When you're working with whoever you are to be part of this planning for your community, find out how you can be part of whatever's regularly scheduled, and don't miss out, or don't assume that they're testing your stuff for you.
Yeah, absolutely. And then really think about so this is part about maintaining the plan, right? Is there a process for getting input and updating your plan after each regular exercise? So first have that regular exercise, but then, debrief and say what worked, what didn't work, how do we update our plan? Because again, that's the kind of thing that often is in someone's head. Oh yeah, we should have done this differently. And then the actual plan itself never gets updated. It's just in someone's head that we should have done this differently. Well, that person leaves and out goes that piece of knowledge. And so the emergency happens and you're like, we should have done that differently, but nobody said anything and nobody changed the plan. So, really have like, whose responsibility is it after to debrief the group and then to make updates to the plan? And then really think about, is there a need to communicate this to others in the school or community? So you might be an FQHC working in a school, and so you have, trained your staff, you know what to happen, but have you communicated to like the community members? Do the students know? Do their family members know that you do have this backup plan in case there is an emergency? Because they may not know. And if they don't know, then they can't access your services because they don't even know that you have services available to them. So I will just wrap up with this. Remember, when disaster strikes, the time to prepare has passed. And I think this is like, the mantra of almost every emergency planner. But if you don't do your planning now and you wait until the emergency is imminent or actually happens, you're going to be scrambling and doing things that are just kind of fly by the seat of your pants, and it will not be well thought out. But the other thing I think really is, during an emergency, nothing really goes as planned anyway. But at least you have a plan and how to kind of pivot from the plan, which is a whole lot better than not having a plan at all. And that's our contact information, and I will stop sharing so that we can take some questions if you have any.
I'm wearing the same shirt. As in
Too
my
funny.
profile picture. That's hilarious. I guess I look good in red.
Thank you, Kathy and Amanda, for a wonderful presentation today. It is greatly appreciated, all the information you shared with us. At this time, we now open it up for questions. If you have any questions for Kathy and Amanda, you are welcome to now type those in the chat box. Okay. Let's see. Yes. Oops. I do. Okay, I'll stop. We'll be sure to send that to you in a email. Everyone's contact information will be provided on the slides for you. And we did have questions from our registration. One of the questions asks, how do you get buy-in from school staff given their limited resources and staffing?
That is totally an Amanda question.
I was afraid you were going to say that. Well, it certainly depends on what point in this process you're talking about, right? If we're talking about school telehealth in general, that's a whole other webinar. But specifically around emergency planning, for preparedness like this, I assume the school leadership is already part of emergency preparedness in a greater community. Now, on an individual school basis, going to that one school principal, I don't know. I don't know how much
Right.
authority that one principal really has to commit that school to anything. It may vary where you are, but the real risk of making arrangements with a particular school or particular school principal is that they can be moved. And we found out the hard way that some places where our program has thrived and had total support, and then August 10th rolls around and that principal is suddenly somewhere else and we have to start from scratch. So I would be wary of making very close connections like that, but go towards leadership and assume that they're already part of the solution.
Yeah, definitely at least have the conversation with the superintendent of schools for your area. Have that conversation around emergency preparedness, because oftentimes they're a lot more receptive to that conversation than, can I enter your schools and do telehealth
Right.
visits with students.
Right. Also, don't set up monthly meetings. Don't do it. You think you want monthly meetings? Nobody's going to commit to coming to your monthly meeting. Don't do it. Just don't do it.
Thank you. And we also had another question of, how might a school-based health center that currently operates on a free model, so not billing for any service, consider implementation of telehealth?
Maybe send me an email and let's talk about that. I don't even know.
Yeah,
how to
I know. I was like,
that.
that's really complicated.
I mean, it can be done. It depends on how telehealth would help you. But maybe send me an email. Like I said, the contact info will be in the slides that come out from School-Based Health Alliance.
Thank you. And then do we have any more questions? Awesome. Thank you all. And again, if you have any questions, we'll be providing contact information and we will follow up with you about any questions that you have. I want to share a few announcements before we conclude today's webinar. The National School-Based Healthcare Conference will take place in Washington, D.C. from June 30th until July 2nd. For more information and to register, please visit the School-Based Health Alliance website, as well as you are welcome to scan the QR code. And I'm sorry if there believe there may have been a question that just came through.
No, I think it's just a thank you.
Okay. And also, we ask you to please stay connected with the School-Based Health Alliance. We invite you to stay connected. You are welcome to subscribe to our bi-weekly School-Based Health Alliance Digest and also connect with us on social media platforms. At this time, we invite you to complete an evaluation of today's webinar. Again, thank you to Dr. Kathy Weberly and also Amanda Martin North for a wonderful presentation on emergency preparedness and school-based telehealth. Thank you all for joining us today. In the upcoming days, you will receive an email from the School-Based Health Alliance that has all of the PowerPoint presentation slides, as well as a link to the recording of today's webinar. If you have any questions in the meantime, please feel free to contact us at info@sbhforall.org. Again, thank you all for joining us for today's webinar, and I hope you have a good rest of your day. Thank you and take care.
Thanks all.